This question is, should I prepare for birth if I'm planning a cesarean? And my answer is absolutely yes. Regardless of what type of birth you're planning, you should absolutely prepare for it. And here's why. So think about if you were planning any sort of major either physical event or surgery. So maybe you're planning to run a marathon, maybe you're planning to summit something. I personally am planning a big hiking, backpacking adventure this summer that I am now in the spring preparing my body for. And so absolutely, when you are planning any sort of big physical feat, we need to prepare our bodies so that we can mitigate some of the injury that could be involved if we do not. I recently did a different backpacking trip and I didn't prepare as well as I could. And as a result, I had an injury to my knee that has now spent much longer rehabbing than if I would have done a better job at prehabbing. And so that's what we're doing for birth as well. So the goal isn't the birth outcome itself. The goal is to mitigate injuries associated with that mode of delivery. So if someone is planning a vaginal birth or a surgical cesarean birth, we want to make sure that we are prehabbing the body to mitigate any potential injuries as a result of that birth. So if someone is planning a cesarean, they are undergoing a major abdominal surgery, and we want to make sure that our core, our pelvic floor, and our whole body is prepared for that event. Additionally, the pregnancy experience itself is what we're preparing for. We're not just preparing for the birth. What we have seen is those individuals who are having cesareans versus individuals having vaginal births both experience pelvic floor dysfunction post-birth. That shows us it's not just about the birth, but about the pregnancy itself. Pregnancy is a big demand on the pelvic floor. It is a big demand on the entire core system. And we want to make sure that we are preparing the body specifically to be able to handle that with greater ease, with greater resilience, with greater responsiveness, and that way we can mitigate a lot of these injuries and dysfunctions that we're told is just part of the course. No, because you have given birth does not mean that you need to have pelvic floor dysfunction, prolapse, diastasis recti, abdominal separation. There are absolutely things that we can do during pregnancy to greatly reduce and minimize and even prevent all of these from occurring. And we're here to help you.